All right, time to bring up a discussion that I hope more people are talking about mental health. And of course, mental health matters. And joining me as always, the one, the only Miss Kate Sullivan. She is helping me on my crusade to make it a normal conversation talking about mental health. And not just because of the really crazy year we've all had this past year and a half, but just in general, how I think we can be better as a society if we open a dialogue. You know what I'm saying, Kate?
Yeah, and I feel really lucky because I work with the New Hampshire Community Behavioral Health Association, which is the 10 community mental health centers around the state. So I have, over the past couple of years, really had, like a first row seat into,
Right.
what these people are doing to help people in their communities and around the state, and kind of how challenging it gets.
Yeah,
But
absolutely.
also how rewarding it is to be able to be in a position to help people.
Well, and that's really what it is. I mean, if you're somebody who enjoys giving of yourself and helping others, I can't really think of a better career for you. And now more than ever, we need you.
Yeah.
we need
Yeah.
more mental health providers, and we need more people in the industry, right?
Yep. And I think that, what we're talking about as an organization is, the word mental health, behavioral health. A lot of people think that, okay, I need to have a certain certification or a certain
Right.
training to be in this, but that's not true. It's
Oh.
like any other organization where there's a lot of opportunity to be part of, a community mental health center, whether it's, administrative, community support, development, clinicians. So we have 3 people on today who have 3 very different jobs, but all very important within, their mental health centers.
All right. So let's bring them in first. Let's start with Carla. Hello, Carla. How are you today?
I'm good. How's everybody doing?
We're good. So why don't you introduce Carla, Kate?
Yep. Carla is a licensed therapist with Seacoast Community Mental Health Center. So as it says, she's on the Seacoast. And so Carla, do you want to tell us a little bit about your role at the Seacoast and, what you really love about this work?
Sure. Well, I've been at Seacoast for about 10 years now. I've been a therapist for about 20. And I have to say that I am my career basically has been in community mental health. 18 of those 20 years I've been in community mental health. Currently at Seacoast, I serve as the internship manager. And prior to that, I managed some of the intensive treatment teams. And really, the beautiful part about community mental health is we have so many things to offer to people. Mental health is a very challenging thing in people's lives that, affects everything, right? Their ability to work, to relate to others, to the way they think about themselves. And in community mental health, we have the ability to work in teams and provide a wide variety of services. So we can reach the person in the community. We can reach the person here at the center. We become involved in every part of their lives, basically. We can help them with work issues, with family issues, with medical issues. So for many people, we become sort of like their main support, So I think that if you are someone that came into this field because, the majority of us like to help and like to influence in a positive way the life of others, community mental health is definitely the place that you can do that.
And it's so nice to hear.
Yeah.
It's so nice to know from the other end that people working there are really very much invested in, members and patients. Yeah. Carla, so I know that your job, your career does require certifications in certain licenses.
Right.
But that's a role where you can grow into, I'm sure.
Yeah.
Yeah. In fact, there's many times that people come, have started in what we call being an outreach specialist, someone that provides services in the community, and they may come with an associate's degree or they have a lot of life experience and we can get them involved in that. And then I've had people that enter in that position and then go on to do their master's in mental health practices, and then they do their internship with us and they move into a therapist role. So there isn't one way, I guess, to do it.
There's different ways. I like that.
Yeah.
All right, so let's bring in our next guest. Kate, why don't you introduce Miss Krista? How are you today, Krista?
I'm great. How are you guys?
Krista, thank you. So Krista is an associate clinical director with Center for Life Management. And so, yeah, I don't know if you heard, we were just talking with Carla a little bit about, her job. So what do you do? How long have you been in this field, and what do you really love about your work?
So I've been in the mental health field probably close to 6 or 7 years now. I actually started in homeless outreach down in the Boston area and moved up to community mental health in New Hampshire. So prior to working at Center for Life Management, I was working inpatient in the Manchester area. I started as an intern at Center for Life Management. So again, talking about the different ways your career can go. I started as an intern. I worked as a therapist, worked towards licensure. Eventually, in the past couple of years, I stepped into a more supervisory role and now this associate clinical director position. And I think what I love most about community mental health is, like Carla was saying, our services are so far reaching. And I think sometimes we feel like a best kept secret how much we actually do. But again, like Carla was saying, it's really rewarding not just to get to work with the individual, but we are doing a lot of work with people's families and their existing support systems to change how their lives are going, to change how their functioning is going. And it's more rewarding than I think we could say.
Yeah.
And I want to say, I want to say the jobs that, these careers are rewarding, and they are a lot of work because they're putting in so much effort and, attention to it. And so it's work. It's work.
Right. But it's one of those things that at the end of the day, yes, it's hard work. Yes, you're exhausted, but you made a difference.
Right.
You know that you helped somebody get on the path. You know that you helped somebody to feel better. And I think that to me is worth more than gold. You know what I mean? That's a huge, huge reward right there. I love that. All right, we've got one more guest. Let's bring in Dave. Dave, how are you today, man?
I'm doing fine, Nazi. How are you?
I'm great.
Thanks for having me.
Dave, good to see you. Thanks for joining on. So this is a little bit of a departure, your role at West Central Behavioral Health. So do you want to talk a little bit about, what you do, how you came to this position, and what you love about it?
Sure, I'd be happy to. Thanks, Kate. So I'm in development and community relations, which is on the administrative side, not the clinical side. So that's a whole other world, right, within community behavioral health to talk about. And I actually came up with a list of just some titles of jobs that exist that aren't related to me specifically, but there's communications, there's marketing, there's graphics design, there's advertising, public relations, what I do, development, which is also known as fundraising, IT, database management, finance, billing, administrative support, strategic planning. There's management.
Wow.
This is healthcare. So there's a lot of management involved, right? There's direct mail. There's social media. There's content creation. So writers. There's just a great deal. And what I do,
sometimes you do all of those.
Yeah, I mean we do. And there are interestingly there are employment specialists. Okay, there are health coaches, people who help people learn how to eat right, how to exercise. I mean, really some very interesting, different sort of non-specifically clinical, more sort of cross between administrative and clinical positions. And that's in addition to the therapists and to the nurses, the psychiatrists, the docs, the MDs, the peer support specialists, the case managers, people who get out and actually work with clients directly. So there's a great deal going on. I mean, this is really a fascinating world, community behavioral health. And to your point, Nazi, I mean, it's really sort of, I call it work that feeds the soul. Whether you're on you're on the administrative side or the clinical side, it makes you feel good to do this work to help support people, in my case, who are actually interfacing and helping people thrive, sort of turn their lives around every single day.
And Carla and Krista too, do you feel like, Dave mentioned a whole bunch of, jobs that are kind of within his realm. Do you feel like you also have a team and support and people that you work with that kind of hold you up? Because I imagine you need that too, to keep going sometimes.
Yeah. One of the
Absolutely.
characteristics of community mental health is that we work in teams. So you're never a solo practitioner. You're always part of a team. And that in itself, as a provider, as a practitioner, is the greatest advantage versus a private practice where you may be just with a few people.
Right.
And there's so many specialties, like Dave was pointing out, there's so many specialties and experts in their specialties. So it doesn't matter what you're struggling with as far as trying to help a client, you can always reach out to anybody on your team and feed off of their experience and their expertise to help. So you're never alone. You never feel helpless or hopeless.
Right.
There's always someone to support you. So it's super important. Yeah.
Krista, did you want to add
oh,
something to that? I
yeah.
saw that you were kind of agreeing with what Carla was saying.
Absolutely. I think one of the things that's so attractive about working at a community mental health center is the team approach, but also just our access to supervision. Carla mentioned private practice. You can feel a little bit siloed, a little bit isolated, unless you're really hitting the pavement and building your own community around you. Community mental health, you have consistent, reliable supervision, mentoring, and team approach. In my agency alone, we do a lot of peer consults. We have, our individual supervision with our direct supervisor. So there's always an opportunity to bounce ideas and grow and develop in our thinking. And that's the best we can ask for, in the sense that we do work with some tough cases that you don't want to feel alone with them. You don't want to feel like you're the sole person, that your decision making is all that matters. You can bring this wraparound team and everyone gets to put their perspective and their thinking in there. And it really creates the best treatment plan possible for not only the client, but the family as well. It's also super protective for us as providers. It helps prevent burnout.
Yeah, that's awesome, and really important to make sure that the employees and the team members are okay too, because you guys are the ones that are helping. Right. So Dave, for your fundraising, your development, you're also, communications in a way. So part of what you do, is almost like the voice of this work to either people who you're trying to raise money or awareness. Talk about the importance of fundraising in the community mental health centers.
Well, we're a nonprofit organization, and all the community mental health centers are nonprofits, and we're reliant upon a fairly finite number of sources of funding, with Medicaid being one of them. But Medicaid only accounts for about 73% of our actual cost of care. So we have to make up the difference from 73% to 100% in order to actually stay in business and continue to care for our clients. And that happens through fundraising, through private and public sources. So it can be grants from federal or state governments. It can be appropriations from towns. And it's also direct support from individuals who understand what we're doing in community mental health and substance use disorder services, and how important that is to keep the communities together, safe, to keep people out of jails, out of hospital beds, off the streets. We're interfacing with schools, with nursing homes, with jails, with food shelves, with homeless centers. So there's, and this all requires funding that just simply doesn't come from billable time through Medicaid. Right. 85 to 90% of our clients are Medicaid or Medicaid eligible. So, this is a cohort of people that really needs help. And so we really need to raise the money in order to keep ourselves whole and going.
Yeah, it's there's a lot of that back end work that I don't necessarily think people know about. So it's nice to see that side of it too.
Yeah, and I think grant writing is one of those things that I didn't mention in my laundry list that I mentioned earlier. But there are a lot of really talented grant writers out there who may not think of community behavioral health as a place to land, but it's a good one.
Yeah, there's a lot of opportunity. Nazi, do you want to pull up that page so people can see, if they're interested in? So this is right on the New Hampshire Community Behavioral Health Association page. We kind of, highlighted this to paint a picture of what is available. And obviously between everybody here, you kind of get a sense that it's not just one job. You don't have to have one sort of training. And then if you scroll down, we made it available for people to look at what's available in their area. And then it goes right to their the centers near them. And then it goes right to their center of life management.
I love this too. You
Yeah.
can also put in like how many miles or
Right.
or you know, from your home. So let's say you don't mind traveling. Like, you know,
Right.
let's say you do want to, maybe you don't want to talk to somebody in your community, maybe somebody who doesn't know you. You can put in 25, 30 miles away. You know what I mean?
Yes.
I think that's amazing.
So this is for jobs, but this kind of model is also available on the page that says find your local community mental health center. So if you also are looking for a mental health center that falls in your area, you have that, and you can find out what, yep, there you go, where your town and, you know, what center to go to. Because as I've said before, it, you know, we represent the 10 community mental health centers in New Hampshire. So there is community mental health support in every corner of the state. And, you know, these Carla, Krista, and Dave are just 3 centers. So, and they are just 3 roles or 3 careers that you can have in community mental health. So it's important, I think, for people to know we are hiring and there's a lot of opportunity to grow. And that it is a very rewarding career, whether you're doing fundraising or a clinician.
Right, wherever you do. Now, let me ask a brief question to all 3 of you. In addition to visiting this page that we have up on the screen, where's a good place to start? Because as you've mentioned, you've all gotten into the industry in different areas. Let's start with Carla. Where do you recommend somebody get started, get a foot in the door?
You know, always visiting the particular website of the Community Mental Health Center. Mentioned, you know, if you're looking for something at a certain distance from where you live, you know, go to the webpage for that Community Mental Health Center. We all have our mission statements there. We all have a good description of the services that we provide. We all have career pages that you can, with job descriptions that people can get themselves informed about. So that's always a good place to start, for sure.
Excellent. Same question, Krista.
Absolutely. I mean, come directly to our website. We always have job postings there, but we also, I think the centers do a really nice job of advertising events and need areas. You know, so whether we're doing a sock drive or whether we're trying to create awareness about something else happening in the community, it's all going to be on that website. I always shout out NAMI. They're a great place to start if you're just trying to dip your toe in the water of understanding mental health. SAMHSA as well, they do excellent work as far as, you know, on a national, federal level, getting to know this big field of, you know, we call it behavioral, mental, emotional health. It is healthcare, like Dave said, and this is new territory for a lot of folks. And it's exciting that these conversations are happening. And it's okay if you don't know a lot about mental health because you're not alone. So I think the biggest thing is just hop on these websites, look into what we're offering. And if something excites you, set up that informational interview, put that resume in. It's very accessible.
Yeah, absolutely.
And Dave, did you, for development, you know, have you spent your whole career in community mental health, or, you know, how did that work for you? How did you end up there?
Well, I mean, I won't go through my whole career history,
Well, right,
but in terms of development, I started out in higher education. I was in higher education for about 20 years before I made the switch over to community behavioral health. And I mean, you know, development fundraising is fundraising, you know, whether you're in, you know, higher education or any nonprofit, but the nonprofit world, and that's where we are. And I think for starting out, at least if you're living in our region, which is Lower Grafton County or Sullivan County, Lebanon, Claremont, Newport, New Hampshire areas, or anywhere along the border of Vermont, WCBH.org is our website, and there's a careers page there. But, you know, just specifically, I mean, I know someone who just graduated from college and became one of our vocational specialists. I mean, he didn't have any particular training, but he wanted to help make matches between people who were looking for work and employers, and sort of going out and finding employers who would be willing to accept our clients. And
yeah.
this is a great job market for doing that, actually, believe it or not, because there are a lot of employers looking for people. And then and secondly, one other sort of high point right now is that we're doing a great deal of hiring for our mobile crisis response teams, and that's a around the clock 24/7. We've got a staff teams of 2 people in 2 different locations, and for people who want to really get involved in lives and help save lives in moments of crisis when it really matters, and get a lot of people are adrenaline junkies and really like that sort of interaction, and other people are just, they really want to help. And I think it's that sort of, this is the kind of work that really feeds the soul.
Yeah.
It's rewarding. It really, really is rewarding. Wow, this is what a great segment today, Kate.
Yeah,
You brought
I
us
was just
another
thinking
great
that.
segment
I was just
with
thinking
3 amazing people that like just hearing their stories and their passion for what they do. It compels me to want to click on that link. And here, let me bring that up again. But I mean, it just, you see these 3 people that have all gotten into the industry different ways, but their passion is all the same: helping people, making a difference, and getting the information out there so others can be helped by it as well. I mean, I can't think of anything better,
Thank you guys so much for coming on and talking about your experience. It's really helpful.
Thank you.
Thank you very much.
It really is. And once again, that website, it's scrolling across the bottom, nhcbha.org. You can go there to find a mental health center near you. Also, you can go on there to find about how you can get into a career, and you can help other people like these amazing people are doing as well. Guys, thank you so much. Thank you for being here, and thank you for all that you're doing to help everybody.
Thank you, guys.
Bye,
Have a great
guys.
day. Thanks.
You got it. We'll see you next time on Mental Health Matters.